Thanks very much, Chairman. Good to have you all here for the hearing. Seems to me that pharmaceutical pricing is the decision of the pharmaceutical companies, and Big Pharma would like nothing more than a world in which they control the prices, they have huge sway in this building, and their opposition, if you want to call it that, the concerns on price come from individual patients who have essentially no market power. We've seen really significant pricing abuses by Big Pharma. We pay the highest prices in the world for a great many pharmaceuticals here. President Trump is responding to how sick Americans are of pharma pricing by proposing his executive order to lower it and set U.S. pharmaceutical pricing at international standards. I think that's a signal of how things are going out there. In that environment, a PBM done right is the only institutionally powerful correction to pharma's hegemony over prices. Now, we got a little bit of help by letting Medicare do some negotiation. That's a start. We hope we can do more of that. But other than that, it's just an open field advantage for Big Pharma to roll over individual patients with no structural opposition. So a PBM done right is actually a counterforce to pharma's, should we say, exotic pricing structures. Because they're able to buy at scale, because they can apply leverage, because there is excess profit baked into the pharma pricing model, they actually can provide a pretty important service. I don't know about you, but when I turn on my iPad, I pretty much always now see an ad paid for by pharma trying to throw PBMs under the bus for pharma's pricing policies. Now, if you're Big Pharma and people are mad about the way you price your drugs and why Americans have to pay more than essentially any other country for pharmaceutical costs, then, as President Trump noticed by announcing this next executive order, there's a pretty fed up public out there. And pharma's response is not to lower its prices, but to move PBMs in the line of fire and try to make them the source of the blame. So I'm sort of watching what looks like a bit of a political strategy by Big Pharma to point the finger at PBMs. There are clearly problems with PBMs, and the worst problem is if the PBMs and Big Pharma are colluding. If the PBMs and pharma are colluding to make the underlying pharmaceutical prices even higher and not complain about the basic pharmaceutical prices, so that they have a bigger margin that they can negotiate for their clients so that they can get a bigger fee, then you have both pharma and PBMs engaged in a essentially collusive enterprise to cheat the American consumer. That behavior we need to get rid of. But the idea that we need to get rid of PBMs when they're the only significant structural pushback on pharma's pricing, I think would be a real mistake. And when I'm seeing Big Pharma, knowing that everybody's mad at them, running all these ads, throwing PBMs in the way of public irritation, as if pharma doesn't control its own pricing. I worry about this. Mr. Scott, who sets the prices for pharmaceutical products?
Drug companies and drug companies alone.
Yeah, and you'd agree with me that if drug companies and PBMs are colluding to keep prices high just to give PBMs a bigger share and kind of a general truce so that consumers still get screwed, that would be an abuse of the PBM model.
And that is not happening, and you're pointing to the advertisements as good evidence there is no general truce. We have been calling actively for drug companies to lower their list prices on all prescription drugs. That's a key part of what we advocate for.
Yep. Well, my time has expired, but I think there's a role for PBMs here, and I think the most important signal we're seeing right now is pharma's ad campaign trying to defend its exotic pricing techniques by putting somebody else in the line of political fire.